in structural heart interventions. So I am Dr. Suraj Narasimhan. I am a structural specialist from Narayana Health City, Bangalore. So basically, heart has 4 chambers that probably people from the your undergraduate and probably schoolings you would have seen that there are 4 chambers inside the heart, 2 chambers on the upper side and 2 chambers on the lower side. So 4 chambers are there inside the heart. The left side is the pumping chamber of the heart. So left side here it is the pumping chamber of the heart, and this is going to pump the blood towards the whole body. And inside the heart, like 4 chambers, there are 4 valves as well: mitral, tricuspid, pulmonary and aortic. So this is the aortic valve. This usually has 3 tissues at birth. Each and every beat it opens and closes like this. So it opens, allows the blood, closes and stops the blood from leaking. So during opening it allows the blood. While closing it has to stop, and then it has to prevent the leakage from happening. So but then what happens is that once you start aging, then the calcium starts getting deposited on these leaflets. Slowly this opening becomes narrower and narrower, and like this, when it is severely narrowed, it hardly opens. When if it doesn't open, what happens is that the blood, rather than going with just a trickle of blood, goes towards the body. Ultimately, your other organs receive the blood, like kidneys, the liver, the brain, and then it goes for failure, and then it ultimately results in a terminal event. So this kind of narrowing because of calcium deposit is called as aortic stenosis. There is another form of aortic valve disease called as aortic regurgitation. Regurgitation is the valve opens properly, but then it doesn't close properly. If it doesn't close, what happens is that half of the blood will go here, rest of the half will come back once again inside the heart. So effectively it is not able to pump out the blood, and it leaks and then it comes back inside the heart.
The heart is a sensitive part. So how it will happen, that process and everything?
So whenever we apply a license for a new device, the first time is the one which takes a little longer. The first case we had to wait for almost 2 to 3 weeks for the approval to finish. But once the first approval is done, so this is just a predicament. You just show them that one valve has been approved, and the next approval got within 12 hours. So the first step is the most hard step to take. We have made that. Now, after we got the approval for the valve, any hospital in this country, if they apply, they will get it within 12 hours. So only the first step is the more hard one, which we took it. The next case which we wanted to do, within 12 hours we got the approval, and it has to get shipped from through via Hong Kong, and then it took around 24 hours for it to reach our customs. Our customs cleared it under special basis within 1 hour, and then we were able to have the valve within probably 24 hours after it got shipped from outside.
Yes, sir. Just adding on to the same question, but which country you import from?
So this valve is actually manufactured by a company called as a Healing Medical Technology, and they manufacture these valves in China, and it goes to Hong Kong. From Hong Kong we get it to India.
Yeah, you also mentioned it's very safe and the time frame is also less. But how expensive is this software?
So these are all technologies which are imported, right? So it is going to be slightly costlier than the existing valves which we have, and there will be an import duty also added to that because we are importing it. And but there are a few things which happened for these patients. Our hospital was kind enough to extend their financial support for these patients, and we were able to do the procedures under very negligible charges, and our Indian government also. I will talk
First English and then you can. International subject. We can make that not also. Not possible, we can split into. Hey, put the little mic down, boss.
Okay.
We'll say roll, just you can introduce and
Hello everyone, I am Dr. Suraj Narasimhan, interventional cardiologist and structural interventional specialist working in Narayana Health City, Bangalore.
So we have made a landmark in treatment of aortic valve intervention, wherein we have implanted a dedicated valve, TAVI valve, for patients with aortic regurgitation. This is the first time in India where such a procedure has been done. It was not an easy journey for us. We had to specially get approval from the Indian government for doing such procedure, as well as we had to import these technologies from outside country to make it happen. So basically, to summarize this procedure, there are two problems which can happen with the aortic valve. One is called as a narrowing, which is called as stenosis. The other problem which cannot be treated with the current technology is something called as a leakage in the aortic valve. So these leakage patients had only one option, that is surgery before. But right now, with this technology which we have, we will be able to do this without an open heart surgery by putting a small hole inside the leg, going inside and finishing the procedure within 45 minutes. Patient will talk to you within 30 minutes. Patient can walk within 6 hours. His ICU stay is just 12 hours, and then he goes home within 48 hours. And the patients whom we have treated have taken flights abroad within a week's time, and they are able to do all their routine activities probably in a week or so. So this is a landmark in the treatment, because we have seen many patients where surgery is not possible, they are just kept on medications. When you just keep them on medicines, their life expectancy is as less as 6 months to 1 year. The patients were dying in front of our eyes. So our hospital and our team, and as a doctor, as me, we made sure that we got these technologies which were there available in outside countries back to India, so that our patients can also benefit from that. And this is a breakthrough in treatment of such leaky valves.
So when do you think that India can manufacture those kind of an implant and then since the permission that require to import and all that?
So the basic thing is that there are Indian companies which manufactures valves in India, and we should be, as an Indian, we should be proud, because we have companies which manufactures valves in India, and they are used in Europe as well as UK and other countries as well. So we should be happy with that. But this technology is currently not manufactured in India, and I am pretty sure with the bright minds which we have in India, probably in coming years, within a year or so, some company should have a tie-up with a foreign company to start manufacturing. The biggest advantage if you start manufacturing in India, make in India product, is that the price of the products will become more affordable, so that many patients who are needy can also get this therapy for their betterment.
Currently, what would be the cost for this surgery, sir?
So as we are importing these valves from a company which is kept outside, so it costs around 15 lakh rupees just to get the valve imported, and probably the procedures also carry some cost, so it comes to almost around 18 to 20 lakhs. But we were lucky that the government also supported in procuring these things with custom waivering and fast expedition, and our hospital also supported us in waivering the charges for our patients, so we could do procedures at a very, very nominal price for these two individuals.
Thank you.
The opposite direction, but when it does, then the blood goes back in the opposite direction. This is called as aortic regurgitation. So there are two problems which can happen. One is a stenosis, that is narrowing, and it is because of calcium deposit. The second problem is completely different from that. Here there is no narrowing. The valve opens properly, but then it doesn't close properly. When it doesn't close, it starts leaking, and here there is no calcium deposit at all. So these are the two basic problems can happen in the aortic valve. And this aortic stenosis was previously treated by this technology as an open heart surgery. You cut open the chest like that, and then you retract the chest. You make an incision which is almost around 15 centimeter in length. You drill the bone, cut the bone, open it, take out the valve, and put in a new valve and suture it. So this was the norm before 10 years. And after that, there is a new technology which came in called as transcatheter aortic valve replacement. It is a non-surgical and there is no need for general anesthesia. Patient will be awake talking to us when I am doing the surgery. There is no need for a bypass machine or heart-lung machine. It is done just through a small hole in the leg, which is just around 5 millimeter in size. You put a small hole and then you take a tube inside the leg artery, and through which we can go all the way from the leg artery inside the heart and do the replacement. No ventilator is required. Patient is awake. It is done under general anesthesia. From this small hole in the leg artery, you go all the way inside the heart, and this is the valve which is narrowed because of the aortic stenosis and calcium. You put a balloon over there, expand this valve, and the native valve, that is the tissue valve, gets pushed towards the side. Once it gets pushed towards the side, then we implant the new valve through the small hole which we have created in the leg by crimping the valve over a balloon. And this valve goes from the leg artery all the way into the patient's own heart, and then you just, by inflating the balloon for 5 seconds, the new valve opens up and then it starts functioning immediately. So this is a beating heart surgery, so we never stop the heart during this procedure. And once this procedure is done, the tubes will be taken out. If you really think how much time it is going to take, it hardly takes around 20 minutes, the whole procedure. And after that, the patient goes to ICU, stays there only for 12 hours, where a normal surgery requires 3 days of ICU stay, and the patients go back within 48 hours from our hospital. And the patient will talk to you immediately after the procedure, and they can talk to the relative, shorter hospital stay, quicker recovery. Within a week, they will be back doing all their routine activities. They can run, they can jog, and then do whatever they want. But then this TAVR procedure was only indicated for the narrowing of the aortic valve. Only when the calcium is there, then we can do these procedures. But for the other problem which I was talking about, that is the leakage of the valve, there were no dedicated devices available. These valves which are available in India can only stick if there is calcium. But in regurgitation, there is no calcium at all. So it cannot go and stick in that place. So this is how a surgical aortic valve replacement will look like. A 15 centimeter scar inside the chest. When you compare it with the TAVI procedure which is done through this small hole, this is my hand. It is as small as this small portion of my hand. But for leakage, this is very, very common. It is not very uncommon. This is the third most common valvular